Hello everyone, welcome back. I hope you enjoyed Soga's musical performance and the stretching session with the Dufour-Lapointe sisters. Now it's time for our breakout sessions. We have two very exciting workshops to attend: the Haiti health programs during the pandemic and political turmoil challenges, which is breakout A. Please stay here. Martin, to participate in breakout B, to work in man-predominant environments to achieve transformative gender programming, please return to the homepage of the event and click on the link to the right of the page. Don't hesitate to go back and forth between both sessions. Specifically for this session, if you have questions for speakers, simply click on the session in the app rather than in a general discussion. The presenters will be there to address questions. Don't forget to give your assessment to earn points. We will be back in about 1 hour. Please enjoy your session. Hello everyone and welcome to our breakout session on Haiti. My name is Mélanie Tordeur and I am manager at CanWaCH. For 3 years we've been managing the Canada Haiti Health Network. It started with a call to action from partners and stakeholders working in health in Haiti. In Haiti today, close to about 50 projects have been implemented. Large fields of research are promotion of health and education, reproductive rights, food safety and nutrition, health network strengthening, gender equality, and gender-based violence. For today's session, we have 3 partners introducing their projects. They will talk about the challenges as part of political turmoil and the pandemic, and the progress they have made as part of their program. First, we'll have Pierre Lacerte, who is a representative of the Red Cross in Haiti for now 3 years. They will be talking about urgence santé, improving emergency health in the Croix region in close to Port-au-Prince, the capital. Then Partisan Health Canada with Marleigh Austin from Partners Health Canada will moderate a session with 3 partners to fight malnutrition. They will be talking about adjustments made in the projects since the COVID-19 pandemic and also political turmoil's impact on the project. They will be talking about access to data also. And finally, we will have a discussion with Sylvia Somela, Programming Director at Inclusion Haiti. She is a Program Director since August 2019. And we'll be talking about the collaboration they have with Inclusion Canada, response to COVID, and also share her own opinion on health priorities, including mental health in Haiti. Hello everyone, my name is Pierre Lacerte. I'm Red Cross Canada representative for 3 years now. Today I wanted to introduce to you the Urgence Santé project, emergency health, to improve emergency services in urban areas, and also our response to the COVID-19 pandemic. The Canadian Red Cross has been in Haiti since before the earthquake, working in health. We've worked in the Jacmel area and Jérémie areas also, following the Matthew hurricane We work with Haiti Red Cross also as a partner. After Hurricane Matthew's response, we decided to go back to Port-au-Prince in an urban area. This was during a period of insecurity where we thought it would be interesting to go back to our sources. We would work with volunteers to improve emergency services and frontline healthcare. We've noticed that in the Carrefour Feuille areas where we implemented our project, there was a lack of information on health resources that we wanted with our partners to work on that. This project duration is 2 years, so it should be completed in June 2021. The funding is done with the Canadian Red Cross, and we're working with our partner, the Haiti Red Cross. We have 3 objectives: to improve and strengthen capacity of our partner, the Haiti Red Cross, and emergency services, but especially increase access to health services for the Carrefour Feuille vulnerable population. Beneficiaries of that project is the Haiti Red Cross, 90 volunteers also identified in the Carrefour Feuille area, and the general residents of about 350,000. We have 4 components. Volunteer training of the Haiti Red Cross. We have already trained them in first aid, social and psychological assistance, and a new component is gender-based violence, while we also try to give first aid, but also give references. We also work in prevention and control of epidemics. In Carrefour Feuille, we have improved a lot to increase coordination between partners, with the MSPP also, and providing emergency healthcare. After training our volunteers, they have started to raise awareness in their own community. Each volunteer is able to cover the Carrefour Feuille area, each having an identified zone where they work. So awareness is done on frontline healthcare, but also developing contingency plans in case of epidemics. One of the innovations of the project was the development of a first aid application. Red Cross is working in several countries with this tool. It is an app that is available for volunteers, but also to the general population. It is an application that can be downloaded for free. It is available 24 hours and can be used even without internet access. It helps people in case of emergency and hemorrhage, what happens, 1, 2, 3, 4, what the steps to do, waiting for emergency care, and also gives prevention in the case of, or what to do in the case of disasters. Last March, with COVID, we had to completely readjust our project. Fortunately, because we were already in emergency services, we could easily redistribute funding to react very quickly to COVID while we waited for additional funding. From April to December, we stopped our activities. We received about $160,000 in funding. We work with MSPP and obviously Haiti Red Cross. I'll go over quickly on the interventions we've done with COVID. We started to train our volunteers in Carrefour Feuille on prevention and control. It was important for us that they were well equipped, well protected before sending them out. After being trained, they started to do community awareness. We had banners posters. We distributed brochures also. Markets also, repeating protective measures in markets, yes, with loudspeakers, and also encouraging social distancing. Our second response targeted vulnerable people and seniors. 120,000 of them received information on COVID control and health measures, and we also provided social and psychological support to deal with stress linked to the crisis, obviously. We worked with 5 health centers. So we worked with partner coordination for the zone. Red Cross worked on coordination in different infected sites, hospitals, offices, through disinfection. With schools opening up, we saw there was need with regard to hand washing and protection. We worked in 5 schools where we talked to over 2,000 students. Along with their teachers, we distributed equipment, protective personal equipment, information on COVID, and organized also school activities on social support. We really wanted to know how they felt during this crisis. One of the innovations in our response to COVID was to develop and produce, with a local engineer, hand washing stations, as you can see. Those are pedal activated stations to reduce contamination. 1 meter distancing between people, as we see. We were able to install 21 in the Carrefour Feuille and Thionville districts. After our COVID activities, we decided to transfer those stations to schools where monitoring and maintenance could be performed better. Now here's a little video showing you how this activity with COVID was done. It's on YouTube. You can simply type COVID-19 hand washing station in Haiti. Along with the French Red Cross, we worked to do research on acceptability of new technology with volunteers. Because of COVID, and here a study on knowledge, attitude, practices of volunteers linked to COVID. So this changed a little bit. The study changed a little bit because of COVID, obviously. So I just simply wanted to show you a few results that came out of this study. We're still doing this training here. The study gave us a better understanding of profiles of volunteers. Half of them are women, most of them under 35 years old. They have higher education, and 55% of cases and 35% are unemployed. When looking at their knowledge of transmission of the virus, half of them were able to identify it with fever, breathlessness, the flu also. A risky population being those affected by chronic diseases, risky behavior, touching eyes, nose, mouth, identified at 32%. With this study, we wanted to see how they felt about the risk that they took and their field activities. 79% of them know the risks during their activities. What was surprising is that their risk was not really linked with COVID contamination. It was more about physical assault, and general insecurity, or lack of security, we could say. Some volunteers also were, such as the majority of the population, of part of the population, found it hard to believe that the pandemic was really in Haiti and that it was really a health issue. Some of them also felt that we hadn't really addressed the needs of the population, especially with regard to food safety.
I also wanted to share with you a few lessons that we've learned during this COVID crisis. So during the COVID, we were also in a period of insecurity. This allowed us also to revisit our security measures. Now, all of our volunteers have a WhatsApp security communication device, so we can follow where our staff, the volunteers, are at all time. Now, for obstacles, it was complicated in the beginning when we wanted to organize training, but with the office spaces that we rented, we were able to respect social distancing, have smaller groups, have masks with hand washing stations and so on, so we could have the training of our staff. We also worked a lot with Zoom and other such software during this period. At the beginning of the pandemic, we had a problem with incomprehension and the denial of the population. There's a lot of denial of the population on really the importance of this pandemic. We had to review our messaging, and we also have to go target smaller groups to have discussions with them. Like many partners, at the beginning of the epidemic, we ended up with a shortage of protection material. In the future, we should have, a stock, a permanent, standing protection warehouse, so to speak, with all of the protective equipment for the next time. Another lesson we learned is that with our partners, we saw that during the crisis, COVID, they had more direct access. They were also able to develop an experience related to all the protection measures, develop protocols for the offices. It's an experience which was fairly positive for us despite the circumstances. I'll conclude by saying that the planning for 2021 for the project will come back to this project to conclude it, and the project should be finished next June. These next 6 months, will focus on the preparation for the response to these disasters. We want each community to have a kind of contingency plan so we can be prepared for the next emergency. If we had more funding from now until June, well, we're thinking about extension of our zone, i.e. with the same objectives of our project on the improvement of emergency care, or stay on Carrefour and integrate a response for food security. So thank you very much for your attention. You can always contact me with the Haitian Red Cross or contact the Haitian Red Cross. So thank you, Pierre, for your wonderful presentation. I really liked how you used many pictures throughout your presentation. This helped us understand your activities. So now I have 3 questions to deal with you. And you spoke about the application, the app for a mobile phone that you developed. Did you consider the inclusion of COVID for emergencies and response to emergencies? And if I understand well, the app is used by the volunteers of the Red Cross as well by the committee. Is that correct? Yes, absolutely. In June, we were smack in the middle of the COVID. We were developing the app, so we were able to integrate COVID in our app. There's a COVID part where we talk about, what the COVID is, the modes of transmission of COVID, also how to prevent the transmission. It's in Creole and in French. Now, the app is accessible to the whole population. So for us, it's an additional tool for our volunteers. Volunteers who've taken their first aid courses can then use it as a kind of cheat sheet. The app does not replace first aid courses. It just gives advice for a first aid response, and it can be adapted also regularly. We have a local team with a person from the IT who can adapt this app on an ongoing basis. Okay, thank you. And now with the vaccine against COVID, which is now available, what are the discussions that are ongoing with your partners at the grassroots level? And what does the community think? What do you hear from your own people's opinions on the vaccine? Well, the Canadian Red Cross is interested by a vaccine. We've been here since the beginning with the response to COVID. That would be the next step for us. We are very active with everything related to engagement and awareness building. This includes vaccination. I had spoke during my presentation that there was a certain denial of the population about COVID. I think that we will need a lot of persuasion with our volunteers to convince the population to get vaccinated. We are already with the MSPP on the vaccination platforms. We are in a working group for communication, which means that for us, it would really be interesting. We're already in contact with the local partners. It would be the next step. So that's the answer to your question. Thank you. Now, in your learned lessons, you spoke about new ways of working that you were using, for example, the WhatsApp app, and that you meet in larger rooms. Could you tell us more about the new ways of working and collaborating in your lessons learned that you've implemented since the pandemic? And these new ways, what do you imagine for, are these new ways, new methods that you would like to keep for the future? There, that you have found to be effective? Well, the experience with COVID is that the partners in our project in Carrefour had to collaborate to have a coordinated response. There was a need for distribution of equipment in health centers or with associations. We did this, but at the same time, we established coordination meetings with the people from Carrefour. We'd like to continue these meetings every 3 months, for example, where partners can plan the next 3 months. This will keep these meetings that we started during that COVID crisis. We also worked better with the communities and the leaders of those communities, which means that we already have this contact that's established that we would like to continue. The next step for us would be the development of community contingency plans for the upcoming disasters, the upcoming epidemics with the communities, and we will reuse a bit what we had developed for COVID, this kind of relationship that we had established. We had set up hand washing stations in various places in the community, and this we did with the communities. We really had this discussion on who, where we were going to put these hand washing stations, who would do the maintenance and so on, which means that we really want to leverage this for the next crises. So good day all. Thank you very much. I'm Marleigh Austin and I work at Partners Health Canada. And here today I am with my colleagues in Haiti to talk about the programs related to health in the context of political instability and COVID-19 pandemics in Haiti. So today we were going to discuss about our project for malnutrition. And the agenda of my presentations will begin with the presentation of my colleagues. I'll give you a short overview of the project, including its objectives, its implementation mechanism, and its main performance indicators. And then we'll look at a discussion on the current context and the project activities to see what are the impacts of COVID, the impacts of social disruptions and political disruptions, and to discuss the effect this had on information access, and then the kind of outlook of what's coming up in the future. So I'd like to introduce my colleagues. We'll start with Miss Esther Mahotière. She's a nutrition program coordinator. There's Dr. Kenia Vissières. She's a director of Community Support and Care Program, and also Dr. Alain Cassis, who's a project manager. Yes, and myself, Marleigh. I work in Toronto. So, very quickly, a quick overview of the project. It's called Life-Saving Targeted Malnutrition Treatment Program for Children in Hinch and Saint-Marc. It's a program that had several iterations. It's in this second or third iteration now. And it began the 1st of June 2020, and it'll conclude the 31st of March 2021, so 10 months. It's funded by the CFGB and PWS&D, and it's a project whose main beneficiaries are malnourished children from 0 to 5 living in Saint-Marc and Hinch. The ultimate objective, obviously, is to avoid mortalities related to malnutrition for children from 6 months to 5 years of age. We've had a lot of success with these types of projects in the preceding iterations. We've seen a reduction of 56% in child mortality. Now, the sub-objectives. First, better identification, better screening of children from 6 months to 5 years who are suffering from acute malnutrition. Also, an improvement of the treatment cascade for those children, and the improvement of the resilience of households to diseases. So it's really prevention. So I'll give the floor to my colleagues in Haiti to really give you an update on what the community has been doing for malnutrition from acute to severe. So I leave you the floor, my colleagues in Haiti. Good day all, I'm Esther Mahotière. I work for Zamni Lasante. I coordinate nutrition activities in the community healthcare departments. And we have community activities, awareness building activities, and also we try to screen children who are under 5 years of age who are suffering from malnutrition. We take charge of these children in the community and with hospitals. With the CFGB, we have mobile roving clinics for malnutrition to screen them and to promote the proper nutrition of children, including breastfeeding. Excellent. So I'd like to ask you, we can talk about the impact of COVID-19 on this project. So what adjustments have we made to our project activities? My name is Dr. Alain Cassis. So the adjustments for COVID-19, one of the things we had to do, well, at the beginning, we had to stop our activities. So we couldn't have these large gatherings like we used to do. And we had to move on to institutional care, which were done mostly by appointment. But fortunately, there were many people who were active in the community, so we used them to be able to reach the other people who needed care, but also to provide care and eventually do a bit of screening in the community, but also to give appointments to children who are at risk to be able to reduce the impact of COVID-19 on our activities. So we were expecting that there would be an increase in malnutrition because of COVID-19, but unfortunately, with the help of our staff, we were able to avoid most of these impacts. Something else you want to add? It's not just the impacts, but our capacity to respond. Well, concerning the impacts of COVID, we could say that there were difficulties because there were restrictions of the large gatherings. So we had less clinic days or no clinic days for a certain period of time, which made it hard to screen the children and continue for active screening. And also this reduced our influence in the hospitals. For example, some children with malnutrition complications were transferred in hospitals, but it was also hard to transfer children since they had to have less consultations externally because of social distancing and a number of people who were admitted in the hospitals. So COVID caused difficulties to our strategies of referring and taking charge of these high-risk children. I could ask, do you think that you've seen more for children with malnutrition? Since there had not been any consultation and taking to charge, they did not receive the equipment at the opportune time. So those who became moderate became severe, and those who were severe became acute. But later on, we had malnutrition cases with complication. So COVID disrupted our priorities. And I know that as a team, we wanted to have an extension of the project at AISH at the beginning of March, and we had to push the beginning of that until the month of September or August. So this was a fairly important impact. So thank you, and we'll continue with the next slide. See, what are the impacts that the social and political issues had on your project, and what adjustments did you have to make? Now, for social political disruptions, since there were riots in certain locations, it was hard for the team to travel between these various, Port-au-Prince and other communities. So there were demonstrations, there were, well, riots, there were days of strike where we could not go out to do our activities. So social political disruptions, basically stopped our roving clinic activities. And the effects, well, it was hard to reach our objectives since we had to cease our activities completely because of the social political disruptions. The number of children we had to visit during a certain period, well, since we had no roving clinic, we couldn't reach them, and it was hard to find them in the communities too because of these social political disruptions. So what adjustments should we make? Well, we hope. Well, when there were no social political disruptions, we were able to do mobile clinics on several sites. So we were able to go where we were not able to go during the riots. So this required a lot of effort on the part of the team to go visit those sites when we were able to go. Thank you, Esther. How did the pandemic have an impact on the data of the project, and how did it have an impact on information access, including information sharing between the various organizations working in Haiti? Well, concerning the data, the pandemic, well, since there were no activities, data were restricted, and it was hard to share with the PH team in Canada. So we needed to have monthly data. But for a certain period of time, we did not have this data because of the cessation of our activities. But concerning the partners who work for nutrition in the country with the department, well, normally there's a technical nutrition committee for the whole country with which we normally have meetings at each last Friday of the month. So it was hard to meet amongst partners with the department. So we had to do meetings on Teams or Zoom. So sometimes it was difficult to find the partners. Because with the pandemic, all the meetings are done on Teams or Zoom, so there's an overlap of meetings. So many people complain that there are too many meetings on Zoom, and these meetings lasted more than 3 or 4 hours. So it's to share information. So it was hard to do this. So this lasted from March until November. We had our first meeting with the partners starting from December, and during the month of January, we had another meeting. And this meeting in person, well, this first meeting during the month of December, this allowed us to meet once again and to replan strategies to share our information. Thank you. And to conclude, what are your plans for 2021? Have these plans changed compared to the initial plan because of pandemic and all this? Good evening, it's Kenia Vissières. I am responsible for the community program. Now, concerning 2021, we have not really changed our plans or strategy to intervene at the grassroots level, except we have to be very flexible, which means that we will continue to try to adapt ourselves because we don't anticipate, well, obviously, we cannot anticipate these social and political disruptions or the other catastrophes, but we maintain our plan, but while remaining flexible to be able to adapt our strategies if needs be. So yes, we'll continue with the roving or mobile clinics to be able to reach more clients. And we will also continue with the institutional activities. So our quotas will remain the same. We'll continue to try to reach the same number of households. But we know that we'll be forced to continue to improve and to adapt ourselves. Thank you very much. Thank you very much to the whole team. We really appreciate that you took the time to share all this information with us. And yes, if you have questions now, do not hesitate to ask them now. Thank you. Yes, good day, Sylvia. Thanks for having connected today to take the time to participate in our event. You have a wealth of experience to share. And based on my understanding, you collaborate with your colleagues in Humanity Inclusion Canada. Could you talk about this collaboration? Yes, so we're always in contact, a very strong connection with the national associations, like we call them, from Humanity and Inclusion. So with Canada, we're mostly connected with, well, because we benefit from a funding from the Quebec Program of International Development, and it's an accompanying program for the handicapped persons and groups of women in the North and Northeast to support them on technical capacity building and organizational capacity building, amongst other, on the development of their capacity to do advocacy. Okay, thank you, Sylvia. Since the beginning of the COVID-19 pandemic, humanity inclusion in Haiti is focused on two main intervention domains, i.e. respiratory therapy and psychosocial support. Could you explain more about your interventions in these two domains and the work that you do and the work of your partners? Yes. So interventions, well, in response to COVID-19 are a bit broader. Our first intervention was really quickly done. It was to support, well, for the Department of Health, to support the population and the World Health Organization also, where we were very much involved in the awareness building. So the first actions were to leverage the help of our partners to increase awareness the most vulnerable persons, amongst others, handicapped persons, disabled persons, who as we know, in a humanitarian crisis, rarely have access to information on the services and rarely have access to information. Now, COVID response project that we developed that are still ongoing are mostly focused on two things: a hygiene aspect or prevention, sanitary prevention, in relation to hygiene, with, of course, the whole COVID aspect included, also with the distribution of hygiene kits. And the second aspect deals with food security. So for food security, the project takes the most ad hoc adaptation, based on the zone where we are. It could be food safety, for example, a basket of food, or we'll have cash transfers. We were able to do this very quickly last year, starting in the month of April, May, by reorienting a certain number of funds with the agreement of our funding agents, amongst others, the Belgian collaboration, TSD, Grandis, which is also another funding agent. And we were able to do this thanks to their authorization. And this allowed us to intervene very quickly. Then, and this is where I'll talk about respiratory therapy and psychosocial support, we had an emergency envelope from the CEP and the United Nations for a project for quick response that we started in August and it will end at the beginning of May. Yes, indeed, which also has the focus on hygiene, one on food security, also on which we are there to support an inclusive response. So this is support we give to all the GNOs that have had access to this envelope from the CEP in Haiti, two that are national, and us amongst one of the three internationals. And now to come back to respiratory therapy and psychosocial support on these two issues dealing with health. Well, at the beginning, when we drew up the project following the call for tenders, it was the end of June, beginning of July. And for the propagation of COVID, we had kind of passed the peak at the beginning of June. And most of the country was in a monitoring mode, a very strong monitoring mode, since we did not know how this disease would evolve, if it was going to get worse or not. So the proposal that was made is an answer to take charge of the patient who in the subacute phase for respiratory therapy. So started with psychosocial support. So these two activities were anticipated in the COVID response centers.
Propagation of COVID then really went down. And September, October was very low. Unfortunately, I think we are really in a second wave since the positivity really went up considerably starting in November. The situation is alarming. We support partner readaptation centers and also new health centers, for example, sanatorium, and hospitals we're not partnered with. And we have centers, it is for service continuity, and sanatorium type of hospitals, it is to start to integrate the early rehab patient management. This helps us doing two things. Respiratory therapy in Haiti is not proposed in physiotherapist curriculum. Physiotherapy is not really recognized, I would say. And this breathing therapy or respiratory therapy is a first program in Haiti. COVID really helped to stress how that rehab work was important. Oxygen therapy, that sort of patient management. This helped us to add that aspect, that additional part of respiratory therapy and technicians in rehab and physical therapy curriculums. So we had a few first collaborations in Haiti. Our partners reoriented their priorities and offered to healthcare centers a complementary support or simply psychological support. This is a component that will go into our future 3-year strategy. It is in line with our desired and our willingness to help healthcare centers to have a holistic patient management approach. Thank you, Sylvia. Thank you. This was a fantastic description of your program that you had before the pandemic, how this was a readaptation understood also, how you approached this with your partners. Maybe one last question. Can you tell us about one priority in Haiti that changed since the beginning of the pandemic? You talked about food security, obviously. You talked about your activities. Have priorities changed now in Haiti with the pandemic? Answer. In terms of healthcare in Haiti, obviously, what is important is that there's COVID, but also there's social and political tensions, a lot of turmoil since 2018, and obviously there's the threat of natural disasters, hurricanes, earthquakes. This year's hurricane season left damages, especially in the southeast. We are facing a lot of floods, landslides also. Unfortunately, in Haiti, just like in several countries, well, these are occurrences, right? There's several impacts to this. All of these compound to worsen situations. COVID, weather, and politics contributed to this functioning. Essential services were disturbed. Neonatal health was disturbed also. And in health, there's of course this problem of food security. In light of COVID, the situation is even worse. And what already was a severe crisis based on IPC's last year report, 40% of the population is affected by this. everyone also agrees to say that in terms of mental health, we really need to develop services and access to services. What we notice is that the aftermath of the 2010 earthquakes is not quite over. And to this, we can also add financial security. So all types of insecurities, criminality, kidnappings, this is a population undergoing permanent stress. In between the lack of financial means, the daily fear of not seeing members of or your relatives the next day, well, on top of everything that happens in late September, currency exploded. So obviously not everybody is paid in dollars in Haiti, and food prices did not go down. The food basket went down, but savings in Haiti is done in dollars. Several things are paid in dollars. For example, rent. All this compounded, I really don't know how Haitian are still able to stand up. We see staff obviously are very much affected, much less upbeat, but really all credit goes to them. I'm worried for children who, on a daily basis, regardless of the time of the day, see crimes, murders, violence. Violence is rampant, and this is problematic for the future. Obviously for children, but for everyone. There's a desire, obviously by everyone, to address mental health, but it needs to be better developed, taken into consideration, and there's prior work that needs to go into this. Strong prior work and awareness to the population. And what is psychological support? Psychological support is the source of rejection, of worry and concern. So that is basically it. Obviously, humanité et inclusion has a small part to play in Haiti, and I would like to thank our partners. Thank you very much. Thank you, Sylvia. This is the end of our session on Haiti. I want to thank everyone for tuning in. Thank you to our presenters. Now, if you have any questions, please don't hesitate to use the WOVA app, and presenters will be delighted to answer your questions. Thank you.
The other organizations. Thank you very much for sharing, Sophia. The session on Haiti is over. I would like to thank everybody for listening, and thank you to presenters.